Hello, everyone, and welcome to the Mouthy Matters podcast, where I get to talk to Jennifer Seider today. She has been a dental hygienist for nearly 30 years, and she is absolutely an expert when it comes to bacteria in our mouth that can actually make our gums bleed. So I have all kinds of juicy questions for you today, Jen.
I'm so excited. This is so fun.
I love it. So let's kick off with, what is a gum infection anyway? Like, what is periodontal disease? What is gingivitis? We hear these terms and they sound very dentally, and they sound like kind of ambiguous.
And I mean, that's the question. That's the big question that patients ask. Hey, my gums are bleeding? Is that normal? It's not normal. Healthy gums don't bleed. It's not from brushing too hard, or maybe not even necessarily not enough. Anytime there is too much bacteria, it can cause an infection, whether it's in your mouth, on your arm, in your tonsils. And that's what an infection is. It's too much of a bad bacteria. And so there's 500 to 700 different types of bacteria in the mouth. And you're probably going to be hearing a lot about this even more. I mean, we've known about this for 25, 30 years. This isn't new science, but it's starting to become more prevalent in patients' magazines, and more patients are starting to be aware of it. And so there's 11 bugs that actually cause gum disease. And so what is gum disease? Like I said, is too much of a bad bacteria. And so, anytime there's bleeding gums, that's a red flag of something else, something more is going on. And you have to remember, this is, we always talk about, Tosha, your gum tissue is just skin. So it's a form of skin. It's about, what do they say? The amount of gum tissue in your mouth is what is on your forearm. And so if all of that is bleeding, how that is going to affect the rest of your body.
Yeah. So what if I'm just a person out there, and when I'm brushing and flossing, like, I don't notice any bleeding, but then my hygienist pokes me with a stick, that's a ruler, she tells me, and then my gums bleed then, and then she tells me that I'm not flossing enough, or he tells me that I'm not flossing enough, and I know that I'm doing like a really good job. So why would somebody potentially have bleeding gums at the dental office, but they don't really notice it at home? Like, what's going on there?
Yeah. So usually that's an indication that the patient is brushing well, doing their job at home, but that doesn't mean that they don't have some sort of an infection or a low-grade infection. And so when the hygienist or the dentist goes in and probes, they're disrupting the bacteria or causing a little bit of inflammation. And so you will have bleeding gum tissues. We call it bleeding on probing. And what a probe is, sounds really bad. What a probe is when they do the measurements, you may hear when you go to the dentist, is 2, 3, 4. You don't want to hear anything over a 3. Ideally, a 4 is kind of starting to get into a red zone there. And so what they're doing is they're measuring the space between the teeth and the gum tissues. And so that is what they're doing. And so I'm just talking basics here, Tosha. Is that okay? Okay. Because I always think about my poor husband, his story. He says, well, I'm sure I do have bleeding gums. She was in there stabbing me with a notched metal stick. And it's like, no, your healthy gums don't bleed. They should not be bleeding. And so anytime there is bleeding, that's the first sign of an infection.
So it sounds like these bacteria, specifically the 11 that you're talking about, they're sneaky little buggers. So they're not just chilling out on top. So if I'm a patient that's brushing and flossing and I'm doing a good job on top with my surface level cleaning, I could go in and my dental hygienist can get a little bit more into those nooks and crannies and find and trigger maybe those bacteria to be like, oh, wait, there might be something going on under the hood. So tell me more about these bacteria. Like, do they just live inside of our gums? Like, we all have probably heard by now that there's this oral systemic, there's this mouth-body connection where the bacteria in our mouth might not stay there. How do they get other places? Do we swallow them?
What I like to say, the analogy is very similar to where if Lennox, your daughter, was to go and fall down on her knee, and you say, oh, you don't want to get an infection. You got to put a Band-Aid on it. You might put an ointment on it because it's an open wound. So the gum tissue, whenever it's inflamed and bleeding, it's similar to an open wound where the bacteria can make their way into the rest. And that's why the difference between if you get in contact with bad bugs on your skin, like if I was to go and get in contact with bad bugs, I don't have an open wound and my skin is a barrier and a protector. So when Lennox was to fall down, and open her knee, the bacteria can make their way in, and that's, you can get an infection. So that's why you say, oh, we got to put a Band-Aid on that. You can't really put a Band-Aid on your gum tissues necessarily. That might be something but yeah, so that's how it makes their way systemically. Anytime there's bleeding and inflammation, the bacteria can just make their way systemically. So that's when, if you do get in contact with those bad bugs, and it's not hard to do, we see with our bacterial test that the spouses, family members, children, a lot of times have the same bacteria. So you're constantly, dating everyone you're drinking after. For example, like if, when Lennox would get strep throat, at times you would be like, okay, don't be running around eating and drinking after anybody, which shouldn't be anyways. But, the bacteria can definitely make their way whenever there is inflammation. So it all comes down to inflammation. I mean, and that was on Time Magazine. How long ago? 15 years ago?
Yeah. I mean, it's incredible how contagious these bacteria are.
Mm-hmm.
I was talking to a doctor the other day, and one thing that she brought up is, even if you're not letting your pet, like your dog, kiss your face, like if you're playing fetch with their toy and you're throwing it back and forth, and by age 3, 70% of dogs have gum disease, the same bacteria that humans have. And I thought about that and I thought, man, even with my own dog, like he's only a year old, but I'm always trying to brush his teeth and keep him clean. But when we're playing fetch, that rope is nasty full of saliva and it kind of grosses me out. And I'm thinking like, well, how close did that get to my face? And I mean, I'm projectilely throwing it, this way.
Yeah.
Those bugs could just be flying at my face.
Yeah.
And so all that stuff is so contagious. It's incredible.
It's so contagious. Yeah. I mean, it's just bacteria. And they're just little microscopic organisms. I'm sure you'll end up showing some of your slides, and they are, they run and go everywhere.
Yeah.
And so, I get asked with our bacterial test, do we know if this bug is gone, say, into the, arterial walls of the heart? Who knows? Everybody is different. It's we don't know. We know there's 56 diseases linked. And I just read a study this morning linking Fusobacterium to breast cancer with the BRCA1, when there's that BRCA1 mutation, the Fusobacterium. Yeah. So you just never know where these pathogens will end up. So, it's best just to, get your gingivitis treated, because that is where it starts, is gingivitis. And I think, if we can really make a difference, is treating those gingivitis patients, those patients that have decent home care. They're doing a good job. They want to do a good job, but they start getting bleeding. And then next thing you know, they might mark heart disease or high cholesterol, diabetes on their medical history. So that's when, to me, that's the most critical time, is the gingivitis.
Yeah. Well, then it's before we've lost any of our jawbone that supports our teeth. I was thinking about an analogy earlier today for patients, and I thought about how, like, the foundation of a house. So before we do our periodontal probing, our gum tissue assessment, really, we're not just assessing the gum tissue, we're assessing the foundation. So it's kind of like doing a soil test before you build a house, or even after you have a house. Like, is the foundation that your house is built on, is that solid? Because you wouldn't want to build a house on a fault line, or if you had termites, you would want to treat those right away. So when we go to see our hygienist, they're ensuring that the foundation that supports your teeth is sound, because if your foundation is not sound, then your really pretty smile isn't probably going to be that pretty for a lifetime. And if termites in the foundation of your foundation, just like these bacteria are, then they're not just in our mouth, or we're swallowing them, they're getting into our gums, and then
we're passing them around.
That mouth body becomes more apparent. So if I'm a patient then, or just any old person, and if I came in contact with these bacteria, what can I do at home to help? Like, so if my hygienist says I need to brush and floss more, I need to use a water flosser or something like that, will that get rid of those bugs?
That's a loaded question. I mean, depends on what bugs you have. So, like I said, we know there's 500 to 700 different types of bacteria, and there's 11 that cause periodontal infections. So with bacterial testing, we're able to really determine what type of bacteria and how much of the bacteria. So if you have a low-grade infection and we do a bacterial test, it's a low-grade infection, your hygienist sends you home with a water pick, which I love. I know you do too. We love our water picks, but with some sort of maybe a medicament in it, brush and floss. And then, they can reassess you. It looks good. We'll keep you on this same path. Will I ever get this gingivitis, periodontal disease again? I mean, that's another loaded question. Will your kid ever get strep throat again? So anytime there's pocketing, there is a chance that you could get infected again with the pathogens. I mean, there's one more nooks and cranny. You just had to get Lennox's tonsils removed because they're nooks and crannies. And so sometimes you have to do that to eliminate those nooks and crannies.
Yeah. So in my experience, I've been a hygienist for 20 years. I had so many patients tell me, oh, Tosha, that water pick is so messy and I made a mess in the bathroom, or I've got a pedestal sink, or, there's no outlet in my bathroom and it's just really hard to use.
Yeah.
Why would that be better than string floss? Because string floss has been around for a long time. And now water picks are, so what, tell somebody, like, why is it so much better?
Well, you can get in and you get in and you flush them out. So the bacteria, it all starts with something called biofilm. And so what biofilm is what I like to say, you talked about a dog, is that slime layer around your dog bowl. So, doesn't take long and you get that slime layer. And so it all starts with that. And so in your mouth, that starts within about 5 hours from a prophy, from a cleaning. So that the water pick really keeps that biofilm layer down. And so it just keeps cleaning that surface. So that way the bacteria are always disturbed. So my opinion, it is a better option than flossing. And so it is messy, but it's worth it. It's so worth it. Don't you think? I mean, I can see from our result reports, before and afters, you can really tell a difference when someone is committed to a water pick. And most generally, don't you agree that most people start using it and they can't do away without it?
Oh, yeah. Once that habit is formed, I mean, for me personally, my husband looks, if he's walking by and I'm doing my water pick, he's like, how do you get so much out of your teeth? And I'm like, I know, I have recession, I've got food traps in there, and there is just no way that floss is going to do the trick. Now, I floss too, because, if you have something, but I can't live without my water pick. I mean, I travel with that dang thing. Like, I've got to. That's going to keep me healthier.
Yeah. Yeah. And there's a lot of options, but I know you've got some of your favorites. So maybe someone could, if they have questions, they could reach out to you, or you can even post it maybe. But, and I think even if you can use a solution is great too.
Yeah. Yeah, absolutely. I mean, even just popping a little bit of peroxide in there, that helps to oxidize, which breaks up that biofilm. That biofilm that you're talking about, Jen, that is not just a slimy layer though, right? I mean, it's truly, so the biofilm that these bacteria have, the bacteria are actually forming them themselves. So these bacteria have, I like to think of it as a superpower. They're creating that jacket around themselves for protection, because if they find their way to our mouth, they feel like it's a pretty good house to set up shop. Like they want to build.
It is. It's nice.
Babies, and they want to stick around. So that means that they have to try to fight our body, and essentially they biofilm.
And 80% of the people, they do stick around.
Yeah. Yeah.
Unfortunately. So yeah, I think that's a good analogy. I like that. That was fun.
So if a person has bleeding when they go to get their teeth cleaned, and the hygienist doesn't recommend any type of treatment because maybe there's some little bit of bleeding words around that, what could I do if I heard that from my hygienist? Like as soon as I go home, to like really take control of my health. So I'm hearing and get a water flosser. I can learn how to use that, and I can link that in the show notes, like the water pick that I like. And I have a little home care video on YouTube that people can look at, how to use the thing so it's not so messy. What else would I do besides using a water flosser?
I like a Sonicare. I don't know. Do you use a Sonicare or a oral?
Yeah, I'm a Sonicare lover. My husband's an Oral-B lover.
Yeah.
I'm like, whatever one you're going to use, an electric toothbrush is always going to be better than a manual.
It is always best. It's always best. Yeah. And I think maybe even, going back to the hygienist and being like, I'm just feeling like my mouth is not fresh. And so a lot of folks, and it may not even be the bleeding gum tissues they notice first. It may be that they have a taste in their mouth that they can't get rid of, that gum and mints just are not cutting. And so anytime bad breath, and I feel like whenever folks get healthy from periodontal infections, that's the first thing they say is, wow, my mouth feels so fresh.
I love that.
Yeah.
I have heard you talk many times about an older study about donating blood and how those bacteria. So earlier we talked about how the bacteria can get into our bloodstream, and you mentioned that there's 56 diseases that are linked to gum infections. So meaning those bacteria are getting inside of our body and they're triggering other problems in our body. But the blood donation one's even a different spin on that.
Crazy. Yeah. And this was in Blood Transfusion Magazine, and I can send that to you so you can also post that in the show notes as well. It's one of my favorite studies. But basically, when you go donate blood, they do a quick scan to make sure that you're healthy, but they don't check you for
No
periodontal
travel,
infections.
no tattoos.
Exactly. And so what they're finding is the donated blood is actually contaminated with one of our pathogens, P. gingivalis, of course, because that's always seems to be the bug in the studies. But yeah, it even went so far to say that folks that received that donated blood, the recipients, contracted periodontal infections.
Whoa.
Yeah.
And that makes me think too, if I am somebody that needs a blood transfusion, I guess I'm assuming that I'm not in a good way. Like I don't need a blood transfusion because I'm in great health and I don't have
you're sick.
Going on. There's something major that happened that I needed that.
Yeah.
But then I'm inoculated with what I think is clean blood because let's face it, blood transfusion places, they're not looking for periodontal disease causing bacteria. They're not looking for the bugs that cause our gums to bleed. It's just a part of the system at this point. Hopefully someday it will be.
Yep.
But I don't even know that I'm getting inoculated with these bugs. So I just have to cross my fingers that my immune system fights it off. Yeah.
That's
scary.
It is very scary. And so, and it's just the tip of the iceberg. Years, like I've been doing this for 20 years in the bacterial testing. And I remember, where I was standing when I really had the first study. I read the first study in 2007 about Fusobacterium and stillborn. And now it seems like in the last 20, probably the last 10 years, I'll say, I feel like I can't keep up with the studies. I don't know if you feel the same way,
Incredible.
Tosha.
Tell us about the 2007 study.
Yeah. So let me go back here. To my brain.
Put me on the spot.
Put you on the spot. So they actually found Fusobacterium. So I say these words, but it's one of the orange complexes of our bacterial test. So like I said, there's 11, and this is one of the orange ones, which traditionally we weren't really concerned about. I mean, Fusobacterium is one of the ones that I feel like is probably the most common on a report, but they actually found it in a stillborn's lungs. And so it was a big deal. That bug will also cross the placental barrier. So whenever you do have a patient that's trying to conceive, sometimes it's good, to make sure that bug particularly is a little bit lower. But it's a common pathogen. If I was to test myself, I've got a little bit of Fusobacterium and green complex. And so, we all have, most of us, it's really hard to get a completely flat report. Nobody's sterile. Right. But the difference is, I don't have bleeding gum tissue. So even though I do have some of the Fusobacterium and the green complex, they're not causing, creating havoc on my tissues.
Yeah.
That is the key, is inflammation and bleeding gum tissues, because that is how the bacteria make their way to the rest of the body.
Yeah. I think of inflamed gums as, I guess I would say that 20 years ago when I graduated and I thought about gingivitis and gum disease, I truly in my mind pictured a patient that maybe didn't do such a great job cleaning their teeth or, probably had some plaque hanging out in there and their gums looked really red and angry. And then when I was in practice, I just saw so many patients that had bleeding gums. And I started to think, oh my gosh, maybe everyone bleeds because it was so darn common. And I didn't understand the process back then. I had so many tools from graduation, but I needed much more information and education to understand how far the science has come. And so now when I think about somebody with gingivitis or bleeding gums, they could have a beautifully clean mouth. And those bleeding gums are that minor inflammation that you barely ever notice. And I kind of think of it as like a balloon that's overfilled slightly. It will pop easier. So the pop kind of just running along our probe or an instrument, or the person at home flossing, it's kind of like giving that gum tissue a paper cut because it's overfilled with blood, because the blood bringing our first line of defense and trying to get rid of the infection. But that bacteria found a great home. So it doesn't want anywhere. So it just becomes this battle.
Well, and then also everyone responds differently to infection. And we've talked about this before. So it is kind of sad, these folks that brush and floss and do a really good job. Then they're not able to get rid of the bacteria. It can happen. Same thing with diet. It's no different. I mean, there's people that you run around and they're eating Snickers bars every day, all day. And then it's just everyone responds differently. Yeah. And so we have different immune systems, we're made up different. And that is okay. But I think being aware and doing something about it is key. So one thing that I love about dentistry and dental hygiene is anything can be fixed. We can fix it. So you have bleeding gums, it's okay. Don't stress. Do something about it. We can fix it. That is one of the beauties about dentistry. Just
if you know where to look, like
if you know where to look, yeah.
Talking about the lab test. So if I'm listening and I don't know if my practice offers salivary diagnostics, what can I do as a patient to get tested? So, maybe somebody's listening that knows they do a great job, but they also feel like, my gosh, every time I go to the hygienist, like I'm getting lectured about my bleeding gums and I think I'm doing everything and I had a deep cleaning already and my gums are still bleeding and like maybe I have this bacteria. Maybe that's why all these cleanings and everything that we're doing isn't working.
Yeah. So if they're not doing bacterial testing, you look on my website and take them the information and we can get your doctor testing. Quick crash course on doing a bacterial test so they can order the samples, the kits. I know if you're not, let me just show you what they look like here. I know some folks are listening, but here's what it looks like. So we would send those to your dentist. They would do a quick sample on you, send it in to us, and then you would get a report back identifying what pathogens were present, if there is any present, and then what are some extra treatment methods that they could do to maybe help the infection.
I love that. So a very non-invasive test, super easy, no different than getting your teeth clean, just putting some little paper next to the gum line, soaking up some spit, soaking up some bugs, seeing if guys or gals.
And I would just take our information to your dentist. Just take it to your dentist and say, hey, I want to get this done. And by now they probably have heard of this. And so, but have them reach out and I can definitely help them.
I love it. Before we wrap up, one final question, kind of a 2-part question. Okay. What do you wish every person knew when they went to go get their teeth cleaned? What information do you wish that the general public was armed with when they sat in that chair?
Yeah, I think the first thing that comes to mind would be to get connected with your dental hygienist because you're going to see him or her more than you see your physician. And we're there to help you and, talk to them because they really have a lot of information to share when it comes to the oral systemic connection and total body health, really. Blood pressure, everything. We can really help you out. And so if you're open to that, we are your healthcare provider. That's what I just feel like that utilize us as a healthcare provider. And, we can really recognize a lot of things early on in the mouth. And so we're good people, I tell you. Dental hygienists, know how I love us. We do. And we go through training that is like no other. And we know a lot. And so I feel like really utilize your dental hygienist as a healthcare provider.
I love that so much. Couldn't have said it better. Jennifer, this has been too much fun. I can't wait to do it again. Thank you so much for your valuable information. And we'll catch you next time.
Sounds good. All right, y'all. Take care.
Thank you for listening to Mouthy Matters. If this episode helped, I'd love it if you shared it with a friend or left me a quick review. It really helps the show grow. And if you want a simple next step, download my 6-minute guide. It's in the show notes. We'll see you next time.